Good morning. I have my physician's order here and I have my MAR. I have my patient is Demetrius Davis. Her date of birth is 4/11/95 and she has no known allergies. She's in room 303. She's going to be getting gentamicin, ivpb every 8 hours. She's going to be given 13 drops per minute. If it was on a pump, it'll be 50 milliliters per hour. And this medication is due at 8 a.m. And my physician's order and my MAR does match. Okay? And this gentamicin, it's an antibiotic, so she's gonna be getting this for any infection that she has. It's divided into 3 doses, 1 milligram per kilogram every 8 hours. You can further dilute each single dose in 50 to 200 milliliters of IV normal saline or D5W. The rate of administration is each single dose properly diluted over 30 to 60 minutes. So we'll be giving this medication over an hour. And I know that my patient has lactated ringers running, so we're going to check to see if this is compatible. Okay, and the book states that it is compatible with furosemide. I'm sorry, gentamicin. Okay, all right, so now I'm getting ready to prepare medication. Wash my hands. Okay, got my label. I have my gentamicin here. We're gonna do my second check. Gentamicin is the right solution, right medication. It doesn't have any sediment or anything floating in the solution. It looks good to me. So we have my patient. Everything matches up. No allergies. Date of birth 4/11/95, and this is gonna be given every 8 hours. And I'm gonna go ahead and fill out my label, and we're gonna put who it's prepared by, which is me, and we're gonna put my patient's name. And I did notice that the medication was not expired, so I'm gonna put the expiration date on here and today's date and our time. Okay, patient's room number. Okay, and it's prepared by me, and we have gentamicin. Okay, and it comes in a 50. The solution is 50 milliliters. Okay. All right, so we're gonna go ahead and put this label on my solution. Okay. All right, and now I'm gonna go ahead and spike my bag. I'm gonna make sure I prime it down first. And I actually don't have a cap on here because I've already taken it off. So I would make sure I get a new pack that has the cap in it, and I will remove my tap because I have contaminated since it's touched the line. So I will remove my cap and remove this, and we're gonna spike the bag. Okay, and we're going to remove this cap and make sure, I will make sure it does not touch anything, because if it does, the import is considered contaminated since it's already taken off. But we're going to check to see if it's patent. Okay. All right. My line is patent. Okay. All right. So now I'm ready to go in my patient's room. Okay. All right, knock knock. Hello, my name is Tiana. I'm gonna be your student nurse for today. And today I'm gonna be giving you some medication, IV piggyback, okay? Can you tell me your name and your date of birth? Okay, she tells me her name and date of birth. Can you tell me if you're allergic to anything? Okay, she's not allergic to anything. I'm gonna be giving you gentamicin, and this is an antibiotic to help with any infection that you have. So we're gonna make sure we monitor your labs and everything, your CBC, white blood cell count, your liver functions and everything. And at any point in time you start having any burning, itchiness, or shortness of breath, please let me know, okay? All right, so I'm gonna go ahead and perform hand hygiene. Okay, and I'm gonna go ahead and assess my IV site, and I do notice that she does not have any infiltration, phlebitis, or redness to her site. And I'm gonna go ahead and lower the bag to check for patency. Okay, and she has blood return, so it's patent and her IV site is intact. Okay, I'm gonna go ahead and perform my third check at the bedside. We have gentamicin. My patient here, Miss Davis, Demetrius Davis, she has no known allergies. Date of birth 4/11/95. She's in room 303. And this is gentamicin. We're gonna be giving 13 drops per minute. And I would divide that by 15 seconds, and it'll be 3 drops. Okay, so what I'm gonna do now is we're gonna lower my primary bag. And we're going to hang the secondary. Okay. And we're gonna clean the port that's closest to the patient for about 15 seconds. I'm sorry, closest to the bag. Clean the port closest to the bag. Okay. I'm gonna go ahead and insert this. Okay. And now what I would do is go ahead and regulate my drops with my primary. Make sure. And I never filled my chamber up. What I would have done was fill it up halfway so that it's filled. Okay. Make sure everything's connected. Let's see. Okay, there we go. All right. Okay, so it's flowing properly. Okay, now I'm gonna regulate my drops with my primary. Okay, and I'm gonna count 15 by 15 seconds first, and then we'll count for a minute. Okay, all right, so now we're gonna count for a minute, and I'll tell you when to start. Okay, start. Okay, stop. Okay. All right, I'm gonna count again for 15 seconds. Okay. All right, so everything is regulated, so I'm gonna make sure that my patient she doesn't have, are you having any symptoms, any dizziness or headache or fatigue or shortness of breath? Okay, she says no. Just hit the call light if you need me, if you have anything out of the ordinary that you start experiencing. So I've given my medication, and I will come back to the room and to stop my medication. So I'll go ahead and perform hand hygiene, check my patient's name and date of birth. Can you tell me your name and date of birth? Okay. All right. Can you tell me if you have any allergies? Okay. She says that she doesn't have any allergies. All right. So what I'm going to do, Miss Davis, I'm going to go ahead and stop your fluids. Okay. All right. So we're going to go ahead and stop the fluids. Okay. And what we're going to do is we're going to lower the secondary and discard that, and we're going to hang the primary back up and make sure it's going to stop. Okay, and we're going to discard of this in the appropriate bag, and we're going to go ahead and hang the primary back and regulate the fluids. So my patient doesn't have any redness or inflammation or anything. Her IV site is intact. Are you having any pain on a scale of 0 to 10? She says no. Okay, her bed is in the lowest position. Call light is in reach. I will leave the room, document, and report.